everybody, and welcome to video number 2 of the reproductive system. We're going to be focusing on the female here. So with the female, it is intricate just like the male. There's kind of some similar structures, so let's just kind of go over these main structures right here, and then we'll talk about their functions in detail. So we have 2 ovaries, and just like a male has 2 testes, these would be the homologue of the male testes. And if you remember the male testes, that's where the sperm factories are. Your ovary, this is where your egg factories are. All right, now we are going to release an egg into what's called the fallopian tube. There's many names for this: fallopian tube, uterine tube, or oviduct. That egg will travel through here. This would be the homologue of the male vas deferens or ductus deferens. We empty that egg into the uterus. If it's fertilized, it will implant in there and form an embryo potentially. If it's not fertilized, it will be lost during menstruation. The opening to the uterus is known as the cervix. Leading to that is the vagina. This is where the penis would fit into depositing sperm into the vagina if intercourse were to occur. We also do have some external genitalia. So you can see your vagina leading right here. Some external genitalia that we have is basically labium is singular for labia. So that is lips. There's 2 on each side. We have a labia minora and we have a labia majora. Majora would be the outermost one. It would have pubic hair on it. It'd be very similar. It's considered a homologue to the male scrotal sac. We also have what would be considered the homologue of the male penis, which is the clitoris or the clitoris. And so this does have erectile tissue, but obviously size-wise, it's a lot smaller than the male penis. So this is just what's called a sagittal view here. You can see with the female, remember we do have 3 openings. So we have our urethra, we have our vagina, and then we have our rectum. The male, its genital and its genital urinary tract is shared by the same tube. Here in the female, they are separate tubes. All right, let's go ahead and get started here. So the ovaries, these are going to be producing the ovaries are going to be producing the gametes known as eggs, and the process of this is called oogenesis. Remember, the process of forming the sperm was called spermatogenesis. So an egg, a fancy word for an egg, is called an oocyte. So that's where that name is derived from. Here in the female, we have 2 hormones instead of 1 hormone. A female is more on a cycle, so we will see these hormones being produced in different amounts at different times of the month there. A female usually runs about a 28 to 30 day cycle. Oviducts, also known as fallopian or uterine tubes, transport that egg from the ovaries to the uterus, just like I showed you in the previous picture. Usually this is where a sperm would meet an egg. So you know what's crazy is that the sperm have to travel all the way up here, and they usually meet the egg right as it's ovulated there. So they've got quite a journey getting up through the female reproductive tract. The uterus, like we had said before, it's a hollow organ. I'm just going to go right to this image right here, and you guys can stick with your notes if you need to. The uterus is a hollow organ. It does have muscle because when you do have a baby, it does have the ability to contract to push that baby out. It has smooth muscle out here, and then the other layer, which is this bright red layer right here, this is called the endometrium. And the endometrium is the layer where if you were to have a fertilized egg, it would implant in there and grow in that layer. Or if you did not have a fertilized egg, this endometrium would be lost with menstruation. The cervix is the opening to the uterus. This is commonly checked during a female's yearly pap smear. They usually take samples, usually near the opening, actually, probably more near the opening there. It's called a pap smear, and they look for abnormal cells commonly associated with cervical cancer. The vagina is a muscular tube as well. It has these folds that allow for expansion, and this would receive the penis during intercourse, but it also serves as the birth canal too as well. And this is where, if this is sloughed off during menstruation, it would exit out of the body. Your external genitalia, collectively, it's pretty much called the vulva. It's going to include your labia minora, it's going to include your labia majora, and it's going to include your clitoris, okay? And so we already went through the functions of those. Now, females also have what's called breast tissue, and breast tissue, males have breast tissue too as well, but females have different types of hormones that cause these to produce milk or nourish a newborn. And also in females, the hormones will regulate the size of them too as well. So they contain milk secreting glands that would be stimulated during pregnancy to start producing milk. That's usually inhibited. It's a combination, the breast is a combination of fatty tissue and connective tissue with these sort of glandular organs. And so you can see you've got fat tissue in here. You've got these milk glands that are in here too as well. These would empty into ducts and they would empty out of the breast tissue. Now, there's a lot of different parts to breast tissue. You can have the connective tissue, you've got the fatty tissue, you've got the ductal tissue, you've got the gland tissue. So there's many actually different types of breast cancer. And so depending on which type of tissue it kind of invades will depend on which type that you have. Okay, so there's a nice little summary of our organs and their functions. Looking at the ovarian cycle, I told you that females are on a 28 to 30 day cycle. So the ovarian cycle is pretty much from days 1 to 14. On day 14, we release the egg. This term is called ovulation. Okay, this term is called ovulation. And so looking at this right here, before a female is born, so when they're in their mother's womb, they're pretty much determined how many eggs that they're going to have. So I'm a female, and when I was in my mother's womb, I was chosen that I was going to have this many eggs. When I was born, I was actually born with those eggs in an immature state until I hit puberty. At puberty, I started releasing those eggs, one ovary at a time, every month. So usually ovaries switch off, but you know what? Everybody's different. Some people actually have dominant ovaries, which is kind of interesting. I shouldn't say some people. Females can have dominant ovaries, where that's the most common one they release from. And if both ovaries are working at the same time, there's very much a potential for what's called fraternal twins. Okay, so in the first half of the cycle, in the ovarian cycle, we're looking at days 1 through 14. And really, days 1 through 5 is menstruation. So they commonly call that menses. So this is the bleeding sort of part of a female where she loses her endometrium. A lot of people think it's towards the end of the cycle, but it's actually towards the beginning. And then from days 5 through 13, we would have follicle maturation. An egg develops, it goes through meiosis 1 within the follicle. The follicle supports the developing egg, the primary oocyte, the primary egg, until it completes its first meiotic division, okay? And so it sort of nourishes it. You have hormones that are influencing it. One of the big hormones that influences is estrogen. Estrogen sort of helps the primary follicle develop. It also stimulates, you just had your menstrual cycle, so it also stimulates the endometrium to regrow too as well. Now, after ovulation, you get your secondary oocyte, which is kind of arrested or halted in meiosis 2. It's released from the ovary. And if it does meet up with a sperm, this is usually in the fallopian tube, it would complete its meiosis 2. So they would join together. Now, after the ovarian cycle, after ovulation, so we're looking at basically days 15 to about day 26, you're going to get a structure called a corpus luteum. And this is going to produce estrogen, but it's predominantly going to produce a new hormone called progesterone. And progesterone is going to maintain the endometrium. And remember, the endometrium, if you have a fertilized egg, that's where that egg is going to live. And so progesterone basically keeps it nice and thick and very nourished. Now, if you are pregnant and that egg, so they usually that egg, I'm going to go right to this picture actually. I'm going to go right back to this image here. Okay, so if you get a fertilized egg, so let's say your sperm and your egg meet up together and you get this fertilized egg. What's crazy is that this journey is 7 to 10 days. So remember, this was released at day 14. So you make your way, the 7 to 10 day journey, you're at day 24. You're at day 24. You now have only about a day or two to implant into the wall. And when you implant into the wall, when you successfully implant, you release a hormone called HCG. It released that hormone, that egg implants into the wall. It releases HCG into the blood, and that tells this corpus luteum, which is these two right here, this corpus luteum, I should have made that a little bit more clear. That tells this corpus luteum here and here to stay put and continue to release progesterone and continue to keep this endometrium there, because otherwise this would slough off with menstruation. If there's no pregnancy, no more endometrium. Okay, so let me move my slides here and get back to where we were. And so you can see here the corpus luteum would degenerate unless pregnancy occurs. So it's the HCG that actually stimulates and keeps it present. And it does that for about 3 months until the fetus has built its own home called a placenta, and then that maintains its own hormones. Okay, so this is just kind of an overview here. So looking at a cycle, days 1 through 4, 5. Oh, this is not working. Hold on. Days 1 through 5, this is usually your menstrual cycle. And you can see you're starting to see the formation of your follicles. And here is the egg in here, okay? So usually right around here, we get completion of meiosis 1. And basically, this is in a secondary oocyte. It's halted in meiosis 2. We release the egg into the fallopian tube. This is called ovulation. Okay, and then you can see what's left over. This is the corpus luteum. So this is the corpus luteum right here, and this secretes 2 hormones, estrogen and progesterone. Predominantly the big one's going to be progesterone, all right? And if no pregnancy occurs, it basically disintegrates into scar tissue. Okay, so like I had said, the egg is released from the ovary. The uterus will receive and nurture that egg. And so if you do not have fertilization, you're going to have menstrual flow. If it does, that egg will release HCG to maintain the corpus luteum, and hormones of the corpus luteum maintain the endometrium, keep it from going through menstruation. All right, so we do have some hormones which were very similar to what the male had. So follicle stimulating hormone, this is going to be stimulating the follicles, which have the eggs in there for development. So this is going to be early on. This is like days 5 through 10 of the cycle. Luteinizing hormone, this occurs about day 13. It surges to cause ovulation at about day 14. Remember, these are hormones, so they do have to travel in the bloodstream there. Hormones that control female fertility. So coming from the ovary, releasing the hormones estrogen and progesterone. Estrogen early on in the cycle develops the endometrium. It rebuilds that wall. And it also stimulates other female reproductive structures like widening of the hips, breast tissue. Progesterone's job is in the second half of the cycle. So this is after day 15 to about day 27. And it maintains the endometrium and prevents menstruation. This kind of puts it all together. And so what we're looking at here, you can see you've got your ovarian cycle. You can see you've got your days. And then this is also showing your menstrual cycle down here. So you can see the wall decreasing from days 1 through, it looks to 7 there, but sometimes they consider, look at the bleeding here, it's really days 1 through 5 there. And so with the bleeding there, you're having your loss of your endometrial wall. From days 7 through 14, you rebuild it upward. This is predominantly done by estrogen. You can see that. And that also signals the brain to release the hormones FSH and LH, which will cause ovulation. It's predominantly LH that causes ovulation, which is on day 14 right there. Now, we rebuild when we make the wall basically more nourishing with the hormones progesterone. So you can see the hormone progesterone is pretty heightened here in the second half of the cycle. And you can see that we have the corpus luteum right here, which is producing both these hormones in the second half of the cycle there. So this is something to definitely take a look at. You've got a menstrual cycle or the uterine cycle. You've got 2 hormone cycles, and then you've got the ovarian cycle here. Okay, now looking at, there's a video right there. Okay, so when we stop ovulation, this is not something that just happens in one day, but ovulation, if that stops, you've got stoppage in the development of the follicles, and you've got depletion of the hormones. So this is something that can occur over a couple years, 45 to 55 years of age. And so there's a lot of side effects of not having those hormones. Thermostat disorders causing hot flashes, vaginal dryness, growth of facial hair because you have a reduction of your female hormones, increased risk of heart and blood vessels. Estrogen does a lot of maintaining of your blood vessel wall. Testosterone can actually convert into estrogen, kind of crazy. Estrogen sort of prevents the breakdown of bones too quickly, so it can prevent osteoporosis. So if you have a decline in your estrogen, you're going to see a basically bone breakdown happening faster than bone building. Premenstrual syndrome. This is something that occurs about a week before your period or your menstrual cycle. And it's basically maybe women don't have enough progesterone. So it can be treated with supplemental progesterone. Serotonin, which is like an antidepressive type of chemical. Changes in diet, more exercise. And so a lot of different types of symptoms there. Menstrual cramps. When you're going through menstruation, you have basically inflammation occurring, and these chemicals called prostaglandins, these are released by cells of the endometrium, and they cause the smooth muscle cells of the uterus to contract, and then that may cause pain by those muscle spasms. Endometriosis. So basically endometrium, you saw that in the inside of the uterus, it can occur in other areas of the female reproductive system. And so it can actually grow and break down in response to all the changes of your hormones in your cycle, which can cause a lot of pain. Breast cancer, I'd mentioned this before, it may be in the milk glands or it may be in the ducts there. So monthly breast exams, and then at the age of 40, it's usually recommended that you get a screening technique known as a mammogram. And so they look at different things such as the time you got your period. So usually early onset menstruation, early age, menopause later in life, childlessness, so basically not having children, they've associated with increased risk of breast cancer because it's forcing your breasts during child development to make new cells. Obesity too as well, that does sort of fat hormones can be mixed up with female hormones. And breastfeeding, they say, does reduce the risk. It has shown to reduce the risk. So for all the females out there, here's an exam that you could do to check your breast tissue. Okay, and that is it for the female reproductive system.